Hi everyone, Elise LashGordon here with video number 2 about my journey with breast cancer, specifically my surgery. I had my surgery performed at Georgetown University Hospital, or MedStar Georgetown University Hospital, whatever they call it, in Georgetown in Washington, D.C. So my surgery was scheduled on a Tuesday. So what this means is I had to stop eating Monday for my last meal, which right now I don't remember what it was, but that was the last meal. I think I had cheesecake as dessert, I'm not gonna lie. Tuesday morning we had to be at the hospital at 6:30, which is really early. Now I had a procedure at 8:30 as part of the pre-op stuff, and then surgery was, starting at 9:30. Great. So we get that 6:30 check-in, get my bracelet, and then you go through all the pre-op stuff where they ask you 100 questions, again, that you've already answered. You meet with the anesthesiologist, you meet with the breast surgeon, you meet with the plastic surgeon, you meet with all the teams who are going to be part of your surgery. The nurses, the students, because again, Georgetown is school and the hospital is a teaching hospital. So it's always opportunities for learning. This is my post-op bra. So we get there, we do all the pre-op stuff. They get you in a gown and then they put a tag on your bag so they can lock it up for the day while you're in surgery and then bring it, with you to your room later once you're done with surgery. So we met with all these people, and then there was actually a volunteer. They also gave me some type of pre-meds, like to kind of, like for anxiety, I think, because I was kind of sluggish. So a volunteer then pushed me in a wheelchair up to, I don't know what department, for an injection in the left breast where I did have the cancer. So that way they could take a look at my lymph nodes during surgery. And that was what that was. Then they brought me back down. My parents came in, and we were all just hanging out. And then, they went over, and I had to be asked, like, all the different departments, what do you hear? What kind of surgery are you having today? Because they want to make sure that the patient is clear on what they're getting. So I had to say, I'm having a bilateral mastectomy with deep flap reconstruction, skin sparing, not nipple sparing, and take out my port. They're like, okay. So I had to say that, and I had to say that a few times. And then the closer and closer to surgery, they kept giving me a few more meds. Apparently, which this is very funny, once they gave me Versed or whatever that is into my IV, I remember nothing. I was in the pre-op room with my parents, and the doctors were laughing or talking or whatever. And then the next thing I know, I'm waking up barfing because I came out of anesthesia barfing. Great. But apparently, after they gave me the Versed, I'm waving, goodbye, and whoa. I was very much me. I just don't remember it. So my surgery took about 10 hours. I was under anesthesia for about 10 hours. Came out of anesthesia puking. So one of the things with the surgery, so now I have these flaps of skin and fat, which were taken from my belly and put into breasts, turned into breasts. The flap, depending on how the mastectomy is done, is either through the holes of the, if you're not doing nipple sparing, would be through the holes of the areola, or sometimes it's underneath. It just kind of depends on what kind of mastectomy you have. So mine was through the areolas. Those were taken off completely in my nipples, and that's where it was done. After surgery, I had to be checked with a Doppler because they reconnect arteries and veins in that, which is really cool. I had to be checked every 15 minutes. So there was a nurse parked next to me for 4 hours, checking me every 15 minutes. They put this little Doppler, and they want to hear the blood flow in that new flap of skin that was just inserted. After those 4 hours, and I only remember seeing my mom in the post-op. I was so out of it. And once I started puking, I was cut open from hip to hip. They don't want you puking. So then they gave me more anti-nausea meds, which knocked me out completely. 4 hours later, I was finally wheeled into my room. About 4 hours, it was almost 5, into my hospital room where I spent the next 5 days. So that was at 1:30 in the morning, since now we're into Wednesday. So now I get moved to that they're going to check me every hour. And I was out of it, but like every hour they come in and do this Doppler thing. Nobody can, I mean, I know you can't really sleep in hospitals, but you can normally get a couple hours here and there, but they were in every hour. So not only am I nauseous, dry heaving, just had this major surgery, and now I can't even sleep it off, man. So that was the beginning of the hospital stay. My next video will continue with all of the fun things of the hospital that I learned and that I'm going to share.